Okay, well, good morning, Queensland. So I'm joined today with Dr. Young and the Health Minister, Yvette Darth, and we just want to give an update to Queenslanders on a couple of really important issues. Now, the first issue is that we have detected overnight a positive case in the community. I don't want the community to be alarmed at this stage because the woman was only out in the community for a short period of time. So Dr. Young will give the list of venues where she was. She had just finished her 14 days of hotel quarantine and tested positive after she left quarantine. So Dr. Young will give an update, but there are some areas of concern, especially DFO, and also she attended the Portuguese Family Centre in Ellen Grove. So Dr. Young will be giving an update, and we really need people who were at those venues for these specific periods of time to go home and then get tested. That's really, really important because we want to continue to keep the community safe. And the woman was a flight crew person as well. So Dr. Young will give some updates about that. And we've also had 8,302 vaccines over the past 24 hours. Now, hopefully we'll get this issue under control because we have some good news about easing of restrictions. So we're going to be monitoring very carefully how we go over the next few days, and if we get this one community case under control in the community, we will be easing restrictions from 1 a.m. this Friday. So the easing of restrictions will include good news for all of our indoor venues across Queensland. So we're talking about, restaurants, cafes, bars. So they will be allowed to have 3 people per 4 square metres, which is wonderful news. There will be no limits on gathering in people's homes, no limit on outdoor places, and also with that 3 people per 4 square metres, that also means like our reef charter boats and everything will be able to have more people on them as well. I know that's something the tourism industry has been asking for. There'll be no restrictions on aged care, disability services and hospitals, and the buffets and the smorgasbords can also come back. Dr. Young assures me that's safe to do so, and I know there's going to be a lot of people, especially in my electorate of Inala. I know they love the smorgasbords at their local clubs and pubs. Now, there is one requirement we're asking all Queenslanders to do for the easing of these restrictions. It's not a big ask, but we need everybody to do this. We are going to be expanding where people need to check in using that fantastic check-in app. So, to ease these restrictions, we're asking everyone, you've got to check in. So you'll be checking in at more places. For example, going into your Coles or your Woolies or your local bakery, your hairdresser, basically anywhere where you go in, you need to just check in. Going into a shopping centre, if you're going to go to Carindale or Indooroopilly, you must check in. This is going to be really important, and these requirements will also come in on 1 a.m. on Friday. Now, it's not too much to ask for more freedom. We want life to go back to as normal as possible. And I think this is a very small requirement. So the businesses have a few days to get that up and running and under control. Yes, it may be a small inconvenience, but this means you will have greater freedom. So the app is working incredibly well. I know it's expanded to other venues in New South Wales, and we want to make sure that we capture every detail because then it's so much easier for our contact tracers. It is keeping us safe. So I thank everyone for checking in at the moment where they have been around venues and restaurants and cafes, but now we need to expand that to keep everyone safe, especially as we look at easing these restrictions. So look, I'll hand over to Dr. Young and Yvette, and then we're happy to take some questions. Thanks, Dr. Young.
So we have one new case in the community in Queensland today, but they were in the community for a very short period. So they left hotel quarantine at 9 a.m. yesterday morning and then travelled by private shuttle bus with some other crew members to the Hamilton apartments where they stay when they're not in quarantine. Then she spent the day there in those apartments until 4 o'clock when she was at the DFO at the airport. So it's really important to anyone who is at the DFO, at the airport DFO, between 4 and 4:30 p.m. yesterday, they need to immediately isolate themselves wherever they are, in their own accommodation, or if they're a visitor in the accommodation they're staying, and either ring 13 Health or go online and notify Queensland Health so that we can contact you to talk through your risk and what you need to do going forward. It's too early for you to get tested because you would have been exposed between 4 and 4:30 p.m, less than 24 hours, so you won't be positive at this stage, but you may over the next 14 days. So that's why, please, anyone who attended the DFO at the airport between 4 and 4:30 yesterday, immediately isolate yourself. Then the lady went to the city in a private car with some friends, and she was outside between 5 and 6 in the city. So anyone who was in the city between 5 and 6 p.m. yesterday, please monitor very carefully for symptoms, and any symptoms at all in the next 14 days, come forward immediately. We will be looking at CCTV footage to see if we can find people she's actually come into contact with, but at this stage the advice is monitor for symptoms. She then travelled from the city in a private car to a Portuguese family centre, thank you, Premier, at Ellen Grove, where she reached at 7 o'clock and she was there from 7 till 7:50 p.m. So anyone who was there during that time needs to immediately isolate and will be contacting you. She did use the check-in app to check in there, which was excellent, and I hope everyone else who attended that restaurant also used the check-in app. So we got that positive result at 7:50 p.m. and have then started contact tracing all the people that we know that this lady has come into contact with. So she came into Brisbane on the 5th of June on an Emirates flight, and we know she had contact with a positive case on that flight who had the Delta variant, and that of course is my concern. We won't get back the whole genome sequencing result to work out the variant till later today or early tomorrow, and we'll be able to confirm that. But at the moment, I'm treating this case as if she does have the Delta variant, because we know that only fleeting contact can lead to transmission. That's why it's so important. Anyone who went to the DFO yesterday between 4 and 4:30, please immediately isolate so we can just work out what needs to be done. There'll be every chance you won't need to stay in quarantine for 14 days, but we'll work that through. Thank you very much.
So with this case, we are in the best position we have ever been when it comes to community transmission, because we have identified this within the 1 day of the person being in the community, which means any person they've had contact with has only just been exposed. If everyone does the right thing, checks the website and identifies and comes forward that they've been to these sites, we can ensure that there is no transmission of this virus. But we do need everyone who has been to these sites to immediately isolate themselves so that if they do become infectious, they're not spreading it through the community. And we can do this because we know that we have all the measures in place, and we've done this many times before, but with the changes that we're bringing in, we'll be able to do this even better. And as the Premier has said, with easing of restrictions, we ask one thing of the community, and that is to start checking in at more venues. This means your hairdresser, your beauty salons, all of your public-facing businesses and shops, including going into a shopping centre. So when you first enter into the shopping centre, we want you scanning, because you may not go into individual shops, but you may wander around the centre itself, you may sit in the food court and have something to eat. So it's really important that people start checking in. This will come into effect for businesses at 1 a.m. next Friday, but we'll make it mandatory 2 weeks after that. The reason we're doing this is we want to work with businesses. So we want them to download and register for the app. But if they need any support, we'll have compliance officers out there. They're not there to fine over that period. What they're there is to work with businesses and ensure that they are downloading it. If they need any assistance, they're getting that assistance. And we'll be reaching out to the Small Business Commissioner to ask her also to communicate this to small businesses and make sure they've got the support they need to be able to download this app. Because by doing this means we can ease restrictions even more. This means a 50% increase in capacity in our pubs and our clubs and our cafes, our restaurants, our charter boats on the reef. It also means live music venues will be able to increase capacity by 50%. This is really exciting news. And moving to self-serve and buffets actually means that businesses will be able to free up staff. Currently, they've got staff there having to physically hand the food over. And by going back to self-serve and buffets means those businesses are going to be able to free up staff again to do other important work in that business. So it's great news, and we're only able to do this because Queenslanders have done such a fantastic job socially distancing, washing their hands, staying home when they're sick and getting tested if they have any symptoms. We will be watching capacity. It's hard for us to stand up extra testing clinics because people could be living anywhere around Brisbane who have been to DFO and in the city, but we will be watching capacity and making sure that our testing clinics are letting us know if they have extra surges so we can accommodate that and ensure that the staff can meet the demands of the community. But we do ask if you end up at a testing clinic with lines to be patient. We will get that testing done as quickly as possible. But as the Chief Health Officer has said, we're not asking people to race off and get tested unless you've got symptoms, because if you've been at one of these exposure sites, you're not likely to come up positive yet anyway. So we just ask people if they've got any symptoms to get tested. Thank you.
We're having to take some questions.
Why was this lady let out of hotel quarantine? Was she not given a test the
She
day
was.
before she left?
Yeah, she was. She was tested negative. And my understanding is as part of the flight crew testing, she was tested and then she came back positive. Yep.
So she came back positive literally in the 24 hours?
Yep, yeah, it's the
between
requirement of flight crew, yep.
So what's it?
Sorry? Yeah, so she got, so the flight crew got tested, yeah.
Where do you think that she, or what's the theory as to where she got it from? Is it from within hotel quarantine? Or
No, I might get Dr. Young to answer those questions. Is that all right? Yeah.
So on the flight that she was on when she came back from Dubai to Brisbane, an Emirates flight, there was a passenger who tested positive with the Delta variant, and she was a contact of that passenger. So that's the most likely source. But we'll find that out when we get the whole genome sequencing back. But that's why I'm assuming that it is Delta, and that's why I'm taking this very, very cautious approach.
Is it concerning that it's beyond that 14 days?
No, it's not. No. So she was in hotel quarantine for 14 days. She was tested on day 0, day 5 and day 12, and she was negative for those 3 tests. Then she did develop some very, very minor symptoms that she thought were just her normal sinusitis. She didn't pay any attention to them. And then she left hotel quarantine day 14. And she then had a routine test because I require all cabin crew to be tested routinely every 7 days. So this was just a routine test that happened to fall on day 14. And she tested positive.
How concerned are you given that we saw those 2 cases in Sydney who had fleeting contact at Bondi Shopping Centre, like less than, I think it was 30 seconds, and they transmitted the Delta variant? If this is the Delta variant, how concerned does that make you?
I'm very concerned. That's why I'm asking everyone who's been to the DFO between 4 p.m. and 4:30 p.m. yesterday to immediately isolate themselves. And for people who've been in the city, although she doesn't believe she went into any stores in the city, she only wandered around some of the streets. Anyone in the city to be alert to any symptoms. But we need to, this is jumping ahead a little bit, I need to find out first that it is the Delta variant, and we just need to work with her because we only found this out late yesterday exactly where she's been. She's been very, very helpful, but we now need to go and double check all of those times. So some of those times might change, and we'll get that information out as soon as we get that.
Come back today.
I hope so, but that's a big ask. It usually takes 24 hours.
Those people that she came into contact with that you know about already, are they all now in hotel quarantine?
Oh, they're being tested. Yes, all of those. So the flight crew that she was in the shuttle bus with, the people in the restaurant, the people in the apartments, yes.
How many close contacts does she have, roughly?
We're working that through at the moment.
When you say apartments, what do you mean by that? Sorry?
At Hamilton, they have apartments there that they use for crew that aren't in quarantine. So airlines traditionally, of course, have crew that stay over between flights, and they use those apartments. But they're not quarantine apartments, they're for people who've already finished quarantine.
She was an air hostess, sorry, did you say?
She was cabin crew, yes.
Just with regards to the new requirements around the check-in hut, what's the penalty for businesses that don't comply with that requirement?
It'll be the same penalty that we have with all our directions.
What is that currently?
It varies. So from 1,300 up to 4,000.
Are you confident people will actually use the app based on the current usage?
I'm very confident, yes. People have been really, really good at using the app. We've seen that. So I'm very, very confident. And I'm exceptionally confident about business. Within the days of the last requirement to have the app in place, 98% of businesses had already put it in place. So yes, I am confident.
So all stores have to have it in place by Friday, so just like supermarkets and other retail stores that previously didn't need it.
That's right, but we'll work with them for 2 weeks for the smaller places, but a lot of places have voluntarily already put it in place, so really we're just catching up and now making it mandatory.
How do you expect these types of arrangements to be in place for everyone to check in essentially everywhere they go?
Until we've got the vast majority of our population vaccinated against the strains that are circulating at the time.
Just with that cabin crew, you said that she has to, or whoever it is, has to get mandatory testing every 7 days. How come she ended up getting mandatory testing on the first day she got out of hotel?
Because it's every 7 days, and 7 days happen to fall on that day.
So you're really lucky that that hasn't been today.
We are, yes.
Yeah. Okay. Yep.
What's the arrangement there? Do we pay a cent at all for these arrangements with the
Look, we've worked very closely with the federal government in relation to these arrangements. So basically, New South Wales was helping with some of the service delivery for a period of years. We've now taken that on. Look, we've spoken to the tourism industry as well. We think there's great opportunities there for Queenslanders to go and visit Norfolk Island as well. So already 40% of the population utilise Queensland health services. I think there's around 1,400 people who live on Norfolk Island. And we're very happy to come to this arrangement with the federal government. So I thank the Deputy Prime Minister, Michael McCormack, for dealing with our government very closely on this. We also sent Minister Grace over there with a small delegation just to check everything, and it seems like the vast majority of people on Norfolk Island were very happy for Queensland to be involved.
Just in regards to Riverfire, I guess look
Yes.
through the return, and is it exciting, and maybe I guess a bit about what the COVID safe plan might be in light of new cases like this one.
Yeah, well, of course, we will be monitoring the situations as we do on a daily basis. But at this stage, Riverfire is going to be back bigger, bolder and better than before. And we will be encouraging families to come out and view Riverfire. I think it's going to be a fantastic event. It's a signature event of our state.
What does it mean for tourism? Is there a dollar figure that we can put on an event like this?
Oh, I think there will be millions of dollars into tourism as well, because people come and stay in the city. They dine at restaurants. It's going to be a great atmosphere for everyone.
And how do you? I guess you said at this stage, Riverfire.
I can't predict what's going to happen in the future, but at this stage, it's all systems go. Yeah.
Do you plan to bring in any further hotspots given the growing situation in New South Wales?
Dr. Young's going to be continuing to monitor that. We're keeping a very close eye on New South Wales, so we'll continue to monitor that on a daily basis.
And those restrictions that you plan to ease, how at risk are they of being eased given this outbreak?
In terms of
Yesterday's case. talk to
Yeah,
those
well,
guys?
yeah, what I've said very clearly is that we will monitor this week. We are planning to ease those restrictions on 1 a.m. Friday, and of course will be dependent if there's any further community transmission. But like Dr. Young said, we found this case very quickly, we're acting very quickly, and as long as everyone who's been to those venues does the right thing, stays at home, gets tested, I'm very confident we can get through this.
Are you able to tell anything about her movements through the CBD, as you mentioned?
I don't think there's anything more at this stage, but we'll be getting, if people can look at the Queensland Health website, we'll put the information on my Facebook as well for the Facebook users that are online. Hello. But we definitely need to make sure that people are checking those venues and doing the right thing. And if you have any symptoms in Queensland, Queenslanders, can I just please stress again, if you have any symptoms, please go and get tested. This is really important because we want to continue to enjoy our lifestyle. We want to continue to ease these restrictions, and I know that Queenslanders are up to using that check-in app. I've seen them use it. I use it myself. Everyone's got to use it. It's a small little thing to do for more freedom.
Roughly how old is she?
I think about 30, was it?
She's
In her 30s, yeah.
Sorry, just on Norfolk Island again. Will they get a member of Parliament?
No, Jack, they're not getting a Member of Parliament.
Why
No.
not?
Sorry?
Why not?
No, they're not, because they are still administered by the federal government, you know, but it's nice to see we're taking a little bit from New South Wales. First Norfolk Island, next Byron Bay. Only kidding, Gladys. Only kidding.
And it won't cost the Queensland government any money to arrange it?
We'll be providing services. So, you know, we already provide 40% of services of health there, and we'll be supporting education. So look, it's fine. It's close to Queensland, and it'll be a great extra tourism destination as well.
What's that dollar figure then that we're providing?
Well, there's not really a dollar figure. It's just a normal, you know, just helping out with services. It's a small price to pay, Jack, for helping out the Commonwealth. There we are.
Dr. Young, just a couple more
Okay,
questions.
2 more questions.
Thank you. I guess, what kind of a job do contact tracers have? Will they, or who goes through all the CCTV with this new case? And what's the process? Will they have to kind of look from street to street and gather from business to business? Can you walk us through what they'll have to do?
We have a great relationship with police. We have worked so closely together right from the start of this pandemic, and that's what we'll be doing again, working with them to look at CCTV footage, which police will assist us getting, and just trying to find where she's been. It'll be a little bit easier at the DFO because they have a lot of CCTV footage there. So I'm asking everyone who went to the DFO now to isolate, but hopefully we can decrease that down so that not everyone there ends up in isolation for 14 days. But yeah. Oh yes, it's much easier at a restaurant, so we'll be going through that and finding all of those contacts with check-in apps and... No, it's the DFO because there's no other way we've got of getting hold of people. We will be going through CCTV footage, but that takes a while. So I don't want to wait till we've gone through CCTV footage to identify people, to call them. I want them to go into quarantine immediately, and then we'll work out.
And that's why that checking app's going to be so much better now.
It'll be brilliant, yeah.
Last question from me, just in terms of easing these restrictions, is that in response to the huge amount of flack the government's copped about music venues not being able to operate at full capacity?
I can answer that. No, not at all, because, you know, you would have seen in our state budget last week that was handed down, we put $7 million in to help those live music venues. But this is just the great work that Queenslanders have done, so we've been working on this for several weeks. Yeah. Okay, thanks everyone.
Thank you,
have a lovely Sunday. Go and enjoy the beautiful weather.
Thank you.
Thank you.